So many people have told me they would have never taken prednisone had they known about how horrific the side effects are. So I want you to be empowered with what exactly to say to your doctor when your doctor is prescribing prednisone. And if you were recently prescribed prednisone or another steroid, these are some questions you can ask before you take it or after even the first couple of doses. I want you to be completely informed and aware of what you need to ask so that you can go into this with your eyes wide open. Prednisone and other steroids, hydrocortisone, methylprednisolone, dexamethasone, are miracle medications. Prednisone saved my life. I'm so grateful for it. But I knew what I was getting into because I'm a pharmacist. I mean, I knew on paper. I didn't realize how awful it was really going to be. But other people had no idea and wish they'd known. So here are some tips of what you can ask your doctor when your doctor is thinking of prescribing prednisone or another steroid. And then if you're wondering, well, maybe it's not worth it, when to ask for a second opinion. And finally, some safer alternatives you might consider. First, you need to understand what prednisone is going to do to your body and whether it's the best option. Prescribing steroids. What condition are we treating? Like, you want an actual diagnosis. And why are steroids necessary? Are there any other options we could try first? Next, what are the short-term side effects I should expect? How will steroids affect my mood, my sleep, my appetite? Will they cause weight gain, bloating, or changes in my energy levels? What about long-term risks? Are you prescribing this long-term, or is this really only a few days? Will this affect my blood sugar, bones, or risk of infection? What monitoring or tests will I need while taking steroids? How long will I need to take them? Is this a short-term prescription or a long-term treatment plan? How will we taper off the medication to avoid withdrawal symptoms? Could steroids be interacting with any of my other medications or conditions? Say I'm taking medication, fill in the blank. Does that interact? For example, I'm taking ibuprofen. Does that interact? And the answer is yes. It can increase your risk for ulcers and bleeding. Do steroids increase my risk with conditions like diabetes, high blood pressure, or osteoporosis? Yes. So if you're not completely clear about what your doctor is treating you for, and that there's evidence showing that it's actually going to help, that reason is so awful, you're willing to put up with horrible side effects, then take it. The idea is to keep the benefits and the risks in balance. If you are incredibly suffering from your disease, your condition, whatever it is, in my situation, I had a condition where my immune system was attacking my platelets and I could be bleeding to death. I was this close to bleeding to death. Prednisone saved my life. Totally worth it. Dying is infinitely worse than all of these side effects, right? In my situation, it made sense. But does it really make sense in your situation? That's what I want you to get completely clear. What benefits you're going to expect, how well it's going to work for your disease, and what actual risks your doctor foresees for you in your situation with your other diseases and drugs involved. And if you're not completely clear on that, then I encourage you to get a second opinion. Find another doctor who can evaluate your health to make sure that that is totally appropriate for you. Maybe that original doctor doesn't know about the latest new alternatives to medications, injectable biologics, or amazing other treatments. If your doctor can't explain clearly what your disease is and how the steroids are going to help, maybe they don't actually help. Maybe, like one doctor said, no one should die without steroids. Like, just give it to everyone. No, don't do that. Only if the benefits truly outweigh the risks. If your doctor doesn't mention any alternatives, that's a red flag. You want to make sure that you are given a full picture of the treatment options, prednisone and this and this and this, and not, well, prednisone's the only option. Maybe those other treatments won't kick in for a while, and so you need prednisone to work until those kick in. Fine. That's a plan. But not being given alternatives and not seeing the full picture, that's a problem. Seek a second opinion. If your doctor is prescribing prednisone long-term and not monitoring you, that's a humongous red flag, because the long-term consequences of prednisone and other steroids can be horrific, from heart disease to osteoporosis to diabetes to eyes. Like, I have a whole list of things that you need to be monitoring. It's called my Prednisone Checklist. You can click the link below to download that now. But your doctor needs to have a plan in place to monitor. Maybe they're a specialist and they think, oh, that's their primary care doctor's job. No. Whoever's prescribing the prednisone should be monitoring for these things. And if they're not, that's a big problem. Get a second opinion. And then if your doctor is giving you conflicting advice, if one other doctor said you should not use steroids, and then this one is saying you should, yikes. Like if you have a neurologist for one condition and a rheumatologist for another, and one is saying you should never be using steroids ever again, and the other's like, oh, let's try this. Like red flag. Watch out for that. So there's lots of reasons you can get a second opinion, and I've personally driven hundreds of miles to get a second opinion. I've crossed state lines to get a second opinion. I want to know for sure that my diagnosis is correct and that the treatment really is the only option for me. So what alternatives to prednisone might your doctor use? So often for pain and inflammation and other situations like that, something you can give yourself is actually more effective. Ibuprofen and other NSAIDs that are available over the counter are often as effective for certain conditions like osteoarthritis. Tylenol can help. Other forms of inflammation that aren't like life-threatening or vision-threatening or something. Often ibuprofen is enough. You really have to know for sure with your doctor whether it's appropriate, but it's often enough. Ice and heat may be enough. For example, if your dentist is prescribing steroids and they haven't suggested ibuprofen, Tylenol, and ice for like the pain in your teeth, that's not good because those are more effective than steroids. If you have allergies, then antihistamines are a better option. If you have asthma, then a steroid in the inhaler is a much better option unless you're getting really, really far advanced. And then in that case, great, prednisone makes sense. But if you're just having minimal asthma symptoms, then a steroid inhaler is a much safer way to get the steroid into your body. It's targeting your lungs instead of having a pill go across your entire body. If you have autoimmune diseases or rheumatoid arthritis, things like that, other medications like DMARDs, disease-modifying anti-rheumatic drugs, old drugs, or new biologic drugs may be better and safer for you. And maybe prednisone is needed short-term until those kick in. Okay, but those other medications are effective, and for the most part, prednisone is the most harmful drug, and those other medications, even if they look scary, are less scary than prednisone. One doctor at Harvard, he said that prednisone and other steroids are the best drugs in rheumatology, and they're also the worst drugs in rheumatology because of how awful the side effects are. And so we should always be making sure that that benefit and risks make sense, that there's really no other alternative that is going to work for you. Just remember, you have the right to ask questions. This is your body that you're going to be putting this pill into. The dose makes the poison. And when it comes to prednisone, you don't have to take a lot to be feeling horrible side effects. Is that poison or is it just toxicity? It's miserable. That's all I know for sure. And unless the misery of your disease is worse than the possible misery of the side effects, it's not worth it. And talk to your doctor about how to keep that balance of benefits and risks in your favor. And like I mentioned, I have a checklist of things that you can do if you have no other choice but to take prednisone. Just click the link below to download it now. And I go through all of the things that you can do to minimize the risks for complications, to follow up on that monitoring of long-term things that you need to be checking. And so click the link below to download that now. Signing off is Dr. Megan, your prednisone pharmacist.